Welcome, everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water or use an alcohol-based hand sanitizer, use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when you cannot maintain a 2-meter distance from others. I will now report our current case counts. There are 125,647 confirmed cases of COVID-19 in Canada and 41,507 cases in Ontario. Chatham-Kent has 359 cases and Sarnia-Lambton has reported 338 cases. Michigan now has 97,660 cases, with 13,492 cases being in Detroit. Today, we are reporting 2,472 cases of COVID-19 in our community, an increase of 2 cases from yesterday. 1 is travel related to Michigan, and 1 is being investigated at this time. Overall, 26% of our cases are between the ages of 20 and 29 years, and 24% are between the ages of 30 and 39. 65% are male, and 35% are female. 2,326 cases are now resolved, and 74 cases are active and being followed by our health unit. 7 people are in the hospital, with 1 person in ICU. Our community has lost 72 people to COVID. 50 deaths have occurred among residents in long-term care and retirement homes. 2 retirement homes are currently experiencing a COVID outbreak, as well as 2 workplaces in the agri-farm sector. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, shortness of breath. Call 911 if you have difficulty breathing and are struggling to breathe or speak, or are experiencing severe chest pain, if you're feeling confused or losing consciousness. Windsor-Essex will soon have 3 COVID assessment and testing centers. Currently, we have 2 sites, Erie Shores Healthcare in Leamington and Windsor Regional Hospital OLET campus. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. If you have symptoms and have been tested, you must remain isolated pending your test result. To check your results, please go to wechu.org and click View Your Results to access the online test result portal. If you are unable to view your result, please contact the assessment center or the healthcare provider that initiated your test. The health unit will call you if you have tested positive for COVID-19. Please continue to visit our website at wechu.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates.
Good morning and thank you for joining us again. With our move into stage 3 in the region, it included an increased risk to private and public, it increases to private and public gathering sizes from 10 to 50. This group size is different from a social circle, which remains at 10 people. Individuals that are part of your social circle are those that you agree to have close contact with. This means that you are spending time within 2 meters without personal protective equipment. You can physically touch each other like a hug or holding hands. With the gathering size increased, it is important that residents understand the differences and the limitations. A large gathering of friends for an event or private function, for example, can be up to 50 persons, but all persons must maintain public health measures. This means that the 50 individuals should be able to maintain 2 meters of physical distance at all times between themselves and others that are not part of their 10-person social circle. If physical distancing cannot be maintained, all attendees should wear a face covering that completely covers their mouth and nose. Anyone who is feeling unwell should not attend any of these gatherings for any reason and should stay at home and follow up with their medical provider. Maintaining these measures are critical to our community health and well-being and critical to continue to contain the spread of COVID-19 as we open up more services, including schools. Thank you.
The conference is now unmuted.
We'll now take questions from the media. Any questions from Windsor Star?
Yes, good morning, Dr. Ahmed. I'm wondering if you have any update on that website containing guidance for parents and guardians of kids going back to school.
We should be adding it this week. We're still working on
Okay, just waiting for my team. Yeah, so we're adding content to it, and this week it should be up and running. It's just ensuring that some of those linkages are made appropriately. Some of this content is already available, but not on a dedicated web page. It's scattered, so we're just pulling it back together to make sure that it happens. So hopefully sometime this week it will happen, and we'll let you know, Taylor.
Great, thank you.
Any questions from CTV?
Yes, good morning, Doctor. Welcome back. Just curious, today, was that just a reminder about the group sizes and the social circle, or are you getting complaints?
Yeah, so yes, we are getting complaints about the physical distancing and the gathering size, and some confusion when people are thinking about 10 versus 50, and some are thinking that their social circle can now be up to 50. And so it's just a reminder that you can still meet up to 50 people, but they have to have all those physical distancing measures or appropriate public health measures in place, and they can enjoy, but responsibly, just like we say about everything else.
Right. Are we talking like a crazy amount of complaints, or just, or even calls of confusion, or are we just saying enough to warrant you talking about it today?
Yeah, it's an ongoing conversation, and I think some of that is confusion. So we want to make sure that public is aware of that requirement, and we definitely, and I think I touched on it as well. We definitely don't want a social circle of 10 with 10 different group, which practically makes it to 50 people or 100 people, 10 by 10. So just ensuring that yes, you can still have more contacts, that's okay, but you have to have all those physical distancing measures in place to meet them or to say hello to them or to meet them in a gathering. But the 10 people that you can think about should be the ones that you do not have to maintain physical distancing, you do not have to wear any personal protective equipment, and that's why it is important that people can see that distinction and make decisions accordingly.
Okay, thank you.
Any questions from Windsorite?
Good morning. I noticed the resolved cases number actually increased today after kind of being stuck there for a week. I was just wondering if the data migration to the new system is complete or how that's going.
So it's almost complete. We do have about 150 cases that we're still migrating over to the new system, but our EPI has pulled from our old system and has indicated that the number of resolved and active cases are current based on pulling data from a couple places. So it's moving forward, but not quite there yet.
Okay, sounds good. Thanks.
Any questions from CBC?
Yes, good morning. We are getting some numbers back from the Catholic and public English school boards, and it's looking like the majority of students are returning to in-class learning. Any sort of concerns or response to those class sizes that we're going to see in September?
Well, I think we'll still have to look at what those class sizes looks like, and I think our recommendation has been very clear in terms of ensuring that appropriate physical distancing and public health measures are in place. We recognize the importance of in-person learning versus learning at home, and every child is different with different needs, and people have options, and I think that's a good thing. And also they need to understand that there is no risk-free option. There's always a certain level of risk attached to it, and hoping that everyone will make that informed choice and find out what's best for their children. And the school boards will continue to do their best, we hope, and we'll continue to work with them to keep a safe environment as much as possible, to have all those policies and procedures in place, and to keep looking at it, keep reviewing all those measures to find what works, what doesn't work, and continue to refine it to protect our children and prevent any transmission in the school.
Thanks, Dr. Ahmed.
Any questions from AM 800?
Dr. Ahmed, just a follow-up to the school question. I'm not sure if you saw this morning, but the public board retweeted pictures from a school in Windsor, A.B. Graham. They tweeted out pictures of what the classroom would look like. It doesn't look like there's much separation in these photos. I know they're photos, but it looks very similar to what a classroom looked like last year, even when I was back in elementary school. So will you and your team be going out to schools if they ask to give them advice on what the classroom should look like?
Yeah, Rob, I haven't seen the pictures, so I don't know what those pictures mean. But as we have expressed before, we are here to support our school boards, support our community, support any agencies that are working to do the good part of ensuring that we have good measures in place for preventing COVID transmission. One thing to note is these plans are school board's plan, and the Ministry of Education is approving those plans. We are here to provide our support, our expertise in however ways we are, but we want to just make sure that it's not something that we are enforcing anyone or any school board. We are hoping that we are there as a resource. The Ministry of Education has provided a good toolkit for the school. We have provided our toolkit to the school board, and then hoping that using all those information, the school boards and the individual school can make plans that works best for them, for their students, and ensuring the safety of keeping the safety of all students as a top priority. And if needed, if they request, make any kind of request, we'll try our best to accommodate those requests and work with them.
Thank you. I think this question is for Teresa. Teresa, the one case travel related to Michigan, I asked this question a couple weeks ago, but has the health unit found out any details how these individuals are crossing the border?
Am I on? Oh. I don't know this particular case other than that this is not a healthcare worker, but we did have a meeting with the Public Health Agency of Canada last week, or maybe a little longer, and talked to them about the Quarantine Act and the follow-up. And so they have good measures in place, and they have surveillance and compliance officers that are following up related to the quarantine piece of everything. But I don't know the particulars about this particular case or how people are coming back and forth.
Sorry, just a quick one here. So just a refresher for the public. The border remains closed for non-essential travel, is that correct?
Yes. Yes.
So are you shaking your head how these individuals are crossing the border?
We don't know for what purpose the individuals are crossing the border. I'm not sure about this particular case. We do know that this wasn't related to a healthcare worker. So healthcare workers would be an essential worker going back and forth, but this one isn't. Other than the PHAC and the entry into Canada and the Quarantine Act, I'm not sure how people are getting back and forth or for what purpose. I don't know all those details.
Okay, thank you.
Any questions from Blackburn?
No, thank you.
Any further questions from Windsor Star?
No, thank you.
CTV?
Yeah, just a quick one here. Since we're talking about class sizes, I know that St. Clair College has hired somebody that kind of, I guess you can call him the COVID general. He walks around the school and makes sure that everybody's social distancing, making sure they're wearing masks as they travel, between classes or in the hallways and stuff like that. Would it be prudent for schools to maybe implement the same style where they hire someone to walk around the school to make sure that the kids are doing the right thing? What do you think of that?
Thanks for the question, Bob, but I think these are some of those things that will fall into the operation side of the school, and I hope that the school may have some creative ideas to think about the enforcement and how they can best achieve that goal. So really, I think we can do a lot of things, but it all depends on how they can manage those operations.
Cool idea, though.
Yeah, sounds good.
Okay. I just wanted to know what you thought. Thanks.
Any further questions from Windsorite?
No, thank you.
CBC,
No, thank you.
AM 800,
No, thanks.
and Blackbird.
No, thanks.
Thank you, everyone.
Thank you.
Bye.